In this video, we're going to be discussing the wedge catheter. This is a simpler version of a Swan-Ganz catheter, and so we're going to start with this. There will be a full video on a Swan-Ganz catheter at some point in the future. When you open the package, you get the catheter and a small syringe. You can see that the catheter has two ports on it, and at the end of the catheter, there's a collapsed balloon. The port with the stopcock connects to the balloon, and you can see as you inflate the syringe, the balloon fills. This is one syringe that we fill with air, not with saline. You can see at the tip of the balloon there's a hole, and that connects to the port. All these catheters come pre-shaped with a certain curve in it, and you can see that they're marked every 10 centimeters on this catheter, so you can tell how far the catheter is inside the body. On the distal port, you usually connect a stopcock here. You never want air being entrained through the catheter. You would flush through that stopcock until saline comes out of the distal port. Here we have a diagram showing the circulation of the heart anatomy. This is the general path that the wedge catheter will take as you're using it. You can see that venous blood returns to the heart via the superior vena cava and the inferior vena cava. Common access sites when doing a wedge catheterization are the internal jugular vein in the neck, the brachial vein in the arm, which will both come into the heart via the superior vena cava, and the femoral vein, which will come in through the inferior vena cava. Regardless of the access site, once the tip of the catheter is in the right atrium, the remainder of the path is consistent. The balloon is inflated at this point, and so it'll follow the blood flow. From the right atrium, it'll pass the tricuspid valve and enter into the right ventricle. From the right ventricle, it'll pass through the pulmonic valve and enter the main pulmonary artery, sometimes referred to as the pulmonary trunk. From here, it can go into either the right or left main pulmonary arteries. The wedge catheter will usually wedge into one of the segmental arteries. When we refer to wedging, this is one of the fundamental benefits of using a catheter like this. Typically, when a catheter is in a chamber, the distal port of the catheter is measuring the pressure in that chamber. This is still true for the wedge catheter for any chamber that is larger than the balloon. So all the way from the right atrium to the main pulmonary trunk, you're getting the pressure as measured in any of those chambers. Once the balloon wedges, this means that the balloon presses into a certain vessel and the balloon is occlusive around the wall of the vessel. Now the distal port of the catheter is measuring the pressure beyond where the balloon is. If you think about the balloon wedging in either the right or left pulmonary artery, the distal pressure measurement is going to be effectively the left atrial pressure. This is because the balloon is occluding the pressures coming from the main pulmonary trunk and everything behind that, and the only pressure that you're measuring is through the lung and from the left atrium on the other side of the circulation. This allows you to functionally get a measurement of pressure of the left side of the heart without having to do a transeptal puncture or cross into the left side of the heart. In this diagram, we can see the position of the catheter as I just described, going from the right atrium to the wedge position along the top of the diagram. You can see the correlating pressures at the bottom of the diagram. We will go through these pressure differences in depth in a future video, but you can see here that there's a clear difference based on the chamber that you're in, and so you can identify this either using fluoroscopy or just using the pressures as you're advancing the catheter. Now, everything that I've mentioned up to this point can be performed using a normal Swan-Ganz catheter. The biggest benefit of using a wedge catheter that is usually a larger diameter, usually 7 French, is that for procedural interventions on the right side of the heart, you can pass a 0.035 inch wire through the distal port of a wedge catheter. You cannot do this with a typical Swan-Ganz catheter. The 0.035 wires are generally better for support when you need to deliver other equipment over the wire. This is common in cases like doing pulmonary thrombectomy for PE or other interventions.